Nice, Gracie. Good decoy run.
My name's Gracie Holmes and I'm 17 and I've played football pretty much all my life since I was a little girl. I've loved playing football, you know, my family was very big into football, so I started off at a local club called Hynham, and then through that I built into some elite academies such as Aston Villa, West Brom, and then I went to Bristol Rovers pre my injury, and then post my injury I'm now at Hartpury College and representing my national team of Cyprus.
We're going to work through a defensive unit into midfield, a little bit of combination.
She's a fantastic character. She's confident, she's a leader, and she, on the pitch, is a tenacious player.
I'm originally a centre half, but I also play CDM, and I love the position so much because, you know, I love the aggression and the competitive nature from playing around the back. You know, you have to have that mindset of, you know, you can't go in half-hearted, and I think that's always been a bit of my personality, both off the pitch as well as on the pitch. So I was representing a charity tournament. It was just a little competitive sort of nature, but pre-season. Yeah, I just went in for a challenge, like I normally would in a mini fixture, and I stepped across a girl, and as she went in for the tackle, my knee twisted out, but my stud stayed stuck in the astro. It was a lot of pain. I was on the floor straight away, and it almost like cramped up, so I couldn't really walk or put any weight on it at all. It was a really odd feeling because I'm not really one of them people who get injured very often. So for me to go down and obviously be in a lot of pain and not be able to move my leg or anything was really like tough to grasp. I think originally I was a bit like, Gracie, get up, what are you doing? But yeah, it was after obviously a couple of weeks of rehab, I was a bit like, oh my God, like I might actually be like seriously injured. It's not just I've been knocked sort of, I guess, feeling. Then I think that's when we realised something was obviously seriously wrong. We had the MRI scan in October, and obviously that's when a lot of the emotion hit when I realised I had fully ruptured my ACL. I think that was one of the main injuries I've always heard of in, you know, not just the women's game, I mean like the game in football in general. And I think that really obviously broke me a little bit to know that I'm being taken out of, you know, a sport I'm really passionate about.
You're doing just tons of research. That's what led us to Professor Mackay, because we were looking at you know, surgeons that probably dealt with footballers. I think I went off in that direction with my wife Sammy, and we were chatting to people that were surgeons in the sports field, and Gordon come up time and time again, because he's done his own separate research, you know, on ACLs, ACL recovery, and the internal brace. He just made us feel so comfortable, so confident, and he had the same impact on Gracie as well.
We actually went up for the day to meet him instead of a Zoom call, so we had like a in-person consultation, and honestly he was a lovely guy, really funny, and yeah, he obviously he knew exactly what he was doing. He talked through it like it was something so easy, and yeah, he made it really easy for me to understand like the perspective and, you know, just how amazing the procedure actually is.
We'll reconstruct your cruciate ligament. We'll use a very small graft from the front of your knee, and then we'll use this internal brace to make it stronger. And because you're a footballer and a young female, we'll add an extra support, another internal brace on the outside of the knee, so you'll have two in parallel. And that can significantly reduce that risk of re-injury for you. Okay, any questions?
The night before, I was, you know, filled with excitement to obviously get it done and know I'm one step back to being on the pitch. But I think on the day it was more, okay, I'm a bit nervous now, but you got to trust them because they know exactly what they're doing. Obviously, you're allowed to feel nervous, you're allowed to feel a bit overwhelmed, like everyone's going to go through that, and especially I did. Procedure was honestly like a dream. It literally, you went into the operation, you come out and you felt like you just had a good old nap, like it was lovely. So yeah, and in the recovery back home, I stayed overnight for one night and then we went home straight away and I wasn't in any pain at all. So we got given obviously our rehab program to do, obviously from your bed, because at that point you couldn't really move too much around just on your own. It was a lot of crutches, sometimes off the crutches for about a week. So a lot of it was to do it just in your room, moving, keeping the movement in the leg. And then we also got like a machine to stimulate the quad muscle to make sure the muscle's still working, even though, you know, you're not doing squats or whatever like you would normally.
So we've got a wide multidisciplinary team to support her. Things like nutrition, psychology, and the S&C programme that's really helped support her over the last couple of months.
It was a new procedure, so we didn't know a lot about it. So there was questions around, okay, how is she going to come back? What was that procedure that she went through? How much of that surgical part that she undertook? And then it was, okay, how was that recovery going to happen? What was that phases? Are we going to go through our traditional ACL recovery, which is what we tend to do? What we've seen is, yes, it obviously has supported her, what a normal traditional ACL would do. I think the difference would be the recovery process, so how quickly that swelling reduced and how she got a flexion and extension in that limb. And then what we were looking at was how quickly she was out of crutches, walking, moving, and almost kind of a little bit of jogging a little bit. That caught us a little bit off guard, but I think we went with that process. I think the most important thing was getting asymmetries back to normal level, so making sure that she had balance between her left and her right and that we're operating the same way. We wanted to make sure that the hamstring and the quads were functioning appropriately. We wanted to make sure that her proprioception, movement, quality, landing, jumping, and just overall capacity to handle return to sport was still there. Okay, what I would like to do, hands on the hips, counter move and jump. I want you to get as high as possible and push off as hard as you can when you're ready. Really nice, stay nice and stable, wait for me. Okay, one more, let's go. Initial part was really quick, so the swelling reduced, the range of movement came back really quickly. She was able to load the joint significantly quick, which is not typical in some athletes. Obviously, knowing Gracie, she had this really real big determination to get back. There was obviously a period where it slowed down, where her strength levels weren't quite there, where in comparison to what a normal ACL recovery would be, which was expected, but I don't think she understood that. So there was a little bit of an educational around, we still needed to get everything else to work in the right way. And then after she got over that little bit of a hurdle, then it accelerated really quickly. So her balances came back very quick, her asymmetries pretty much reduced below 10%, and her strength levels just significantly improved, which allowed her to return a lot quicker.
Give them a bit of pressure, okay? And then on the next one, can you step in and win it? If you win it, you've done your job, all right? But get tight to her, don't allow her to turn on play.
Yeah, I feel like before I'd fully recovered, I was a bit concerned about coming onto Astro because obviously that's where I did my ACL, but it's completely fine. It's like any other surface, like there's nothing to stress about. I feel really confident like playing, there's no stress at all. So yeah, it's good.
She started for us last week and she's confident, she's excited to be back. She's an exciting player to have within the programme.
I haven't looked back at the rehab process and thought, should have done that differently, should have gone a bit faster, should have gone a bit slower. I think we've timed it perfectly and I do feel like I've come back stronger, fitter, faster than what I was even pre-injury. So that's brilliant to obviously see.
For us, it was really good process to see this go out into an athlete here at Hartpury and hopefully go out to future athletes. That if you have the ability to get this type of surgery, I would go ahead and do it. But just be aware that you're working with the professionals around that you're still doing it in a safe and applied way to ensure that you're at the right levels to return to sport.
If more players can review what Gracie's done and go down that route, then we'd absolutely recommend it.
The procedure has worked its magic because I'm back and, I feel amazing.